to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, Fargo-Moorhead, where we are adding local color to your airwaves here on KPPP-LP. And today we are going to give you updates on how we are doing with this COVID surge in the United States and the globe. In the whole world right now, we have 56,024,130 global cases. Of course, the United States is leading the globe in the number of coronavirus cases. Our response here in the United States has made us the leader in terms of world cases and world deaths. We have over 20% of the world's deaths here in the United States due to COVID and our COVID response. While other countries have had surges, they have not had the kind of numbers of contagion and death that we are seeing here in the United States. By comparison, today we see France is at 2,115,492 cases. In Brazil, they have 5,911,758 cases. Mexico stands at 1,011,153 cases. In comparison to the United States, is over 11 million. Locally, here in the United States, we have a total of exactly 11,814,994 cases. We are over 255,650 dead Americans. We're going to see with these surges the collapse of our healthcare systems. We're starting to see that in places like El Paso. But here in North Dakota and Minnesota, the situation with our healthcare system is pretty bad. Thankfully, some industries, some businesses are starting to police themselves in what can only be categorized as everybody knew this would happen type of news. Carnival cruise ships have suspended all of their cruises until January 31st. I think it's probably going to be longer than that before people can actually feel comfortable going on cruise ships, right?
Yeah, and that was actually something very obvious. I remember we were looking at a cruise. Don't go on a cruise. I mean, it's like it's common sense, but we could predict that one coming.
And there's toilet paper limits again. If you're going grocery shopping, if you're stocking up, those supplies that have been crucial to cleaning, disinfecting, and making sure that we're stocked up in case of lockdowns, you know.
Yeah, the whole wipes, the Clorox wipes, I haven't been able to find those, for 9 months.
Yeah.
But I do have a couple bottles of bleach. So I do have bleach, so I do have some things to do sanitizing. But the convenience of having those handy wipes and that sort of thing just have not been a reality for a while.
And those things you're going to see limits on in the stores in the following weeks. And so make sure that you stock up on everything that you need now as we see more and more businesses closing. And I want to encourage folks, if you have a tip, if you have a story you want us to cover here at the station, you can leave us a message at our call-in line at 701-566-0917. It's 701-566-0917. You can leave us a message of up to 3 minutes, and we'll try to get back to you as soon as possible. You can also follow us on Twitter at media_PPP. You can email Duke or myself at kpppfm.com. Just Cindy at kpppfm.com or Duke at kpppfm.com. You can also follow us on social media, Facebook, 88.1 FM Fargo-Moorhead, the People's Press Project in Mexican. Duke, we have a crisis that is unfolding here in North Dakota and in Minnesota with our healthcare system. And It is happening everywhere else in the country. So we are running into a situation where in the past surges there were traveling nurses and doctors coming in from out of state to help places like New York City when they were hardest hit. And now, as we're going into this third surge in our country, there's no cavalry coming. North Dakota is hitting a new milestone in COVID cases. It is now projected that 1 out of every 1,000 residents in the state will die from COVID. The strain on our healthcare system is truly daunting. One infectious disease specialist at Johns Hopkins Center for Health says he believes North Dakota's virus trajectory officially puts it in crisis. Dr. Amesh Ajala added the state's is a lesson for what happens when you don't plan for cases. A former traveling nurse to the state of North Dakota said she left after just 3 weeks due to poor staffing, calling her time working in North Dakota a beep show, a poop show.
Oh, yeah.
Quote, "It was horrifically understaffed. They took an old hospital slated for renovation and they set it up to be a COVID hospital, with little staff, mostly traveling nurses swimming in the deep end, understaffed, with a hastily set up supply room with no supplies. Rooms didn't get cleaned. There was no nursing assistance and very unsafe conditions. The electricity went out twice with all the patients on ventilators. The pharmacy can't keep up, so medication is not available. I left after just 3 weeks, stating physical, mental, and moral reasons. It's just not worth it, and my license is too precious. Sanford doesn't want anything but bodies. Never again." In response to that, the North Dakota Nurses Association President, Teresa Johnson, said, "That's scary. That gives me goosebumps. That's not the reason that we want to be in the headlines in North Dakota." Local nurses say less hands on deck has left the ICU and their COVID units with double or triple the amount of patient loads. That's concerning, Johnson said. As nurses, we just generally want to give our all in safety and care and compassion. And when you're spread so thin, that's really difficult. In an effort to fight against staff shortages, emails provided to Valley News Live by Sanford nurses indicate nurses are required to pick up 36 extra hours between now and Christmas Eve. A decision Johnson says is only going to lead to burnout and breakdowns. Brian Nermo, president of Sanford Fargo, confirms nurses have been asked to pick up 36 extra hours. It is absolutely has to be the nurse's choice. We cannot be run into the ground, Johnson said. She added that nurses have told her the extra shifts won't necessarily be in the department they already work in, and they will be placed where they're needed. Johnson says this is daunting for many nurses, as they may be placed in units they're not comfortable in or have no experience for. Elective surgeries, already on the books, continue at Sanford, a move Johnson says many Fargo nurses say disgust them. There's only so much you can take. There's only so much you can put your life and your family's life and your children's life and your own well-being at risk day in and day out for, Johnson said. Johnson says while she doesn't know what the right solution is, she does know state and local leaders need to start basing decisions off of hard science. Johnson says, in 8 months, Governor Doug Burgum has not reached out to anyone in the state's Nurses Association. Johnson says the lack of communication and relationship between the state and the healthcare workers, many say it makes the nurses feel unvalued and unappreciated. We're throwing some loose guidelines out there, but it's not working. That's exactly it. It's a dumpster fire, she said. We're preparing ourselves for the worst that's yet to come, and that is terrifying. Working long hours, trying to manage staffing crisis and patient safety and the grief of deaths. Everybody is just kind of hanging by a thread. In a statement from Teresa Larson, Sanford Health Vice President of Nursing, they make a plea to the public in North Dakota, in part saying, caring for the rapidly increasing number of COVID-19 positive patients is not sustainable for hospitals. We need the public's help. You are all now part of the healthcare team. We need you to mask up, practice good hand hygiene, avoid large gatherings, social distance, and get a flu shot. There you have it, Duke. We're all now part of the healthcare team. Did you know you were going to be working in healthcare this year?
Nope, I thought I'd stay away from hospitals as long as I could, as long as I'm not hurt. And, I thought that I would never go into another hospital for another year or so until the vaccine is out there and people.
We may not be able to because of this healthcare crisis. But
yeah, it's something that we haven't really, it's so surreal that this is going on and that the hospital itself is doing a plea like that says that how bad it is. And also the point that the governor in North Dakota hasn't reached out because the governor in North Dakota is not doing a plan. It's up to the local municipalities. And that's why it's easy to say mask up and do all these things. But the truth is people aren't. People are not. In fact, a little study came out from Georgia Tech that said if you're in Fargo and you go to a gathering of 10 people or less, you have a 50% chance of getting COVID right now.
wow.
So if you go out to a bar and there's 10 people in there, it's 50% chance you're going to catch COVID. And that's, that's startling.
Man, I mean, you have better odds by flipping a coin.
That's right. And the numbers in North Dakota are startling. They've been testing a lot. I'm very proud they've done over 1 million tests in North Dakota. There's only 700,000, 800,000 people in North Dakota.
Wow.
But, their positivity rate right now is
But a lot of those are tests that people take, more than once, right?
Yeah, there's a lot of 67,000 people have been positive. Out of those, there's 16 new deaths right now. That's startling. North Dakota's been having double-digit deaths every day now for, I think in the past month it's been most of their deaths have happened in the past couple of months. There's 785 total deaths.
Can I just say something really
Sure.
quick because of the testing thing that you just talked about?
Yeah.
A lot of people are having gatherings and they're quarantining some of them, for 10 days before they go to their family's home for Thanksgiving.
Yeah.
And some of them are doing rapid tests, whether they're doing nose thing, the old kind that we had, or they're doing one of the faster tests that you can do now. They've got saliva tests.
Yeah.
They've got blood tests. I just have to urge people not to trust blindly in the tests. Just look at the White House as an example. They've had rapid tests there the entire time. And because of the testing, the fact that the president is one of the most protected people on the planet, and that the security around the White House staff is got to be the highest on the earth, they didn't have masking and social distancing rules that they enforced regularly. And look what we have. This is the third outbreak in the White House, and it was all because people had a false sense of security because they took a rapid test. So, folks, if you're just taking a rapid test and basing that on whether or not you can meet up with family, it's just not enough. It doesn't detect people that have just gotten the virus and are not showing a high viral load or a lot of symptoms.
Yeah, we're learning as we go along in all this that just because you get a test, look at Elon Musk, he tested negative and positive for COVID.
Yep.
He couldn't go to the launch because what was he, positive or negative? And that's a billionaire who's, not coming through on that. So it's like you do have to pay attention. Plus, things have changed a lot. Even if you took a test and, the whole thing of quarantine for 2 weeks and stuff, this virus will pop up after 30 days.
Yeah.
It depends on what you're doing, who you're around, what sort of contact you're having. And I tell you, it's just, you can say it all the time. People in North Dakota say mask up. They have a whole program where they put up billboards and wear a mask. But right now in Fargo, basically, there's 330 new cases yesterday. That's a lot. 300, cases in Cass County, which is mostly Fargo. If you go to the zip code map, you'll see that most of the cases are Fargo.
Yeah.
In the heavily populated areas.
And you don't see people wearing masks consistently.
No.
There's been a lot of people spreading misinformation about the efficacy of mask usage, saying that it doesn't work, even though the CDC has now updated its information and has shown through studies and through investigation of the use of masks on airplanes and sustained flights and in large gatherings, and people that had COVID being in close proximity to folks that were, patronizing their businesses, and they didn't get COVID because they wore masks. So we're in a state of denial here in North Dakota in many cases, where people still don't think they should even use the masks. And so we don't have effective leadership. We tell people what to do in North Dakota, but we don't do.
Yeah, we don't show them. I don't see a lot of the public officials. Well, I guess one's in Fargo. 3 out of the 5 are wearing masks, and there's 2 that don't want the Fargo City Commission to be able to, or the mayor to be able to have executive orders, so they're fighting against the mayor, and they're both maskless. And the other 3 that are supporting the mayor, and the 2 other ones that are in support are wearing masks. So our own public officials are thumbing their nose at the public and not paying attention. Like in Minnesota, it's very difficult here. We've had over almost 6,000 more cases. We have 237,000 positives in Minnesota. There's almost 3,000 deaths, 2,999. 26 more deaths from yesterday. And in Clay County, where we live, there's almost 4,000 cases. And we're a small county, and we're less than 30,000, a little over 30,000 people in this county. We've had 50 deaths.
Wow.
And that's not good because we're right next to Fargo.
Right.
But Fargo's having, double all this, and it comes over here. Our restrictions in Minnesota, most of our stuff's in North Dakota.
Right.
So if you want to go to any of the clinics, there's 2 clinics or 1 clinic in Moorhead. There's just not a lot of stores. There's a lot of things you can't get. You have to go to Fargo. So, the policies need to work with each other. And, Governor Walz in Minnesota is making an announcement today, I believe, that he's going to be, looking at shutting down kids' sports, for like a couple weeks or a month. You can't.
There's quite a lot of people upset about that.
Shutting down bars, or limiting, and these are the things you have to do. And you can complain. You say, well, they've had a mask mandate. Yeah, but you got to get a right kind of mask. You got to wear it right, too. How many times have I watched people on television and stuff, their masks hanging down below their nose, it's hanging off their ear. They're not wearing the mask properly. And that's part of why it's spreading. Just because they have a mask mandate, if you're not getting the right mask and you're not wearing them properly, you're going to spread or catch COVID.
Those masks that they're kind of like, I don't know what they're called, but they're very thin cloth. They're more like a scarf that fits around your neck. It's very tight, kind of almost sheer fabric. I don't know what they call those neck things.
Yeah, I remember. I know what you're talking about.
But those things actually aerosolize particles further.
Yeah.
And spread them more.
It's a COVID megaphone.
It's a COVID megaphone, so you have to use the right kind of mask. The more effective the mask is, depending on whether it's multi-layered, the different fabrics. We talked about this on yesterday's program, and whether or not you have a vent on it or not. All of these things make a difference.
Yeah, don't have a vent.
No vents.
You can go to, I promoted it yesterday, I'll do it again today. You can go to Facebook and look up Maggie's Masks. And my sister Maggie's wearing masks. She just came out with a whole line of holiday masks that have colorful, fabrics. And she does 3 and 4 layer fabrics. She reads the CDC guidelines and makes her masks that, according to the CDC, to be the most protective, is close to N95 mask, but comfortable. Cover your face, cover your nose. Very comfortable, very effective. Again, it's Maggie's Mask on Facebook.
Now, I want to bring up something that happened in national news, international news, connected to our neighbors to the south, because this is stunning, stunning information. As the elections have wound down, and as our president is shuffling his administration, and by that I mean a lot of firings happening. We have a lot of things going on, a lot of lawsuits that have been going through our court systems with regard to the elections. Meanwhile, last month, a former Mexican defense official under President Enrique Peña Nieto was arrested. This is former General Salvador Cienfuegos Cepeda. This man was investigated and was charged with working alongside of the cartels in Mexico. Basically, Cienfuegos made it possible for the Mexican cartels, drug cartels, to operate with impunity. And he used the might of the military force in Mexico to attack the rivals of the cartel he was working with. Basically, he used the Mexican military as an arm of the cartels to fight drug wars against other cartels. This is incredible. But that's not all Cienfuegos is charged with. And remember, this is the first time that a general, a minister of the Mexican defense under the administration of Enrique Peña Nieto, has been arrested in the United States. Folks, there's a reason why one of the biggest Mexican criminals, cartel leader El Chapo Guzman, is in an American prison. The reason is because Mexico's justice system is and has been corrupted since time immemorial. So, it was astounding to me to have this high of a defense military person arrested for high crimes in the U.S., and to learn yesterday that Attorney General Bill Barr dropped the U.S. drug case against this defense minister and sent him home to Mexico, investigate, and if appropriate, charge Cienfuegos under Mexican law. You have to understand that this man, Cienfuegos, wasn't just involved in criminal activities in Mexican government. No. Cienfuegos is responsible for thousands of U.S. drug deaths and for the murder of a U.S. informant. It is truly astounding. Even the judge that presided over the dismissal of the charges in the United States marveled that this was happening, saying that it was better to have one bird in hand than two in the bush. So we can expect what we get in Mexican justice, and that is probably this man goes free and nothing happens to him.
And our Attorney General's participated in that, just kind of released the Kraken out of the United States. And it makes me wonder, like, our Attorney General, why is he doing any of this stuff? We're in a lame duck session. He'll be replaced soon, as soon as we have our new presidency. And he's doing stuff like this just to muck it up for the next administration.
This is the same week in which Bill Barr reversed almost 50 years of guidance from the Attorney General of not interfering by having investigations into election
That's right.
issues until after the certification of the election, and writing a memo to all Attorney Generals, which they pushed back by writing a letter back to Barr telling them they didn't think he made the right decision.
Oh, yeah.
And speaking of elections, I want to finish off by reading to you the state of our country, the state that we are in, where Republican leaders in the states like Arizona and Georgia, Republicans are taking each other apart. The party, the grand old party, is cannibalizing itself from within. Today, on the heels of the latest scandal involving Lindsey Graham allegedly contacting the Secretary of State of Georgia and insinuating that the Secretary should get rid of votes. After the Secretary of State of Georgia has reported death threats to him and his family, we have this statement coming out of the Republican Secretary of State in Arizona, Katie Hobbs. The Arizona Secretary of State, Katie Hobbs, released the statement in response to ongoing and escalating threats of violence directed at her family and at her office. The truth is, I was prepared for these threats of violence and vitriol. I've been a social worker for many years and can anticipate this reaction when certain people feel powerless and angry. These actions are utterly abhorrent, especially when directed at my family and my staff. They are symptoms of a deeper problem in our state and country, the consistent and systemic undermining of trust in each other and our democratic process. Arizonians deserve to know that elections are safe and secure. This does not excuse the perpetrators. Their continued intimidation tactics will not prevent me from performing the duties I swore an oath to do. Our democracy is tested constantly. It continues to prevail, and it will not falter under my watch. But there are those, including the President, members of Congress, and other elected officials who are perpetuating misinformation and are encouraging others to distrust the election results in a manner that violates the oath of office that they took. It is well past time that they stop. Their words and actions have consequences. Now, I am calling on other leaders in this state, including the governor, whose deafening silence has contributed to the growing unrest, to stand up for the truth. When facing unimaginable challenges this election year, Arizonians stepped up. More people are registered to vote in our state than ever before. Election participation has been at historic highs. Thousands answered the calls to work at voting locations during a pandemic, and people made their voices heard. This should be a time for thanking voters and thanking election workers for their incredible commitment during unprecedented challenges. In that spirit, I offer my gratitude and express my admiration for the Arizonians who inspire trust in our democracy. And I would like to also express the gratitude and admiration of the staff here at KPPP LP 88.1 FM for all the election workers and for all of the leaders in America that are standing up and inspiring trust in our democracy. That's all we have for you today here on 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Have a great evening.
Have a great evening.